Core Master Kit reflects clinical expertise, enhancing the convenience and accuracy of implant surgery through its intuitive drill layout and user-friendly design. Drills are arranged to increase in length to the right and diameter downwards, allowing any user to follow the sequence easily. For hard bone, additional drilling about 1/2 of the next step diameter is required for diameter 3.0 and diameter 5.0 implants. Use dedicated hard bone drills. The osteoplasty burr is used to smooth the alveolar ridge or remove residual inflammation from the bone surface before drilling. The first drill determines the fixture's position, angle, and length. During drilling, avoid applying lateral force to prevent instrument fracture. Applying 7mm first drill is recommended before using a long first drill. After the first drilling, expand the diameter using core drills. The integrated stopper design ensures easy and accurate drilling for everyone. Use 4.0 and 4.5 drills sequentially. Maintain adequate irrigation and proper RPM and torque to prevent bone overheating. Ensure placement stability by under-drilling on soft bone and over-drilling on hard bone. To verify the drilling depth and status accurately by using the depth gauge and probe with their marking. Use the probe at the first drill stage and the depth gauge at the core drill stage. Both tools featured with depth-specific markings allow easy and precise measurement of the drilling depth. After drilling, place the fixture about 80% using an engine driver. Monitor RPM and torque carefully to avoid overheating. Then, complete placement by using the ratchet driver to the final target depth. Once placement is completed, cover it with a cover screw and suture the gingiva to ensure stable osseointegration of the fixture. After osseointegration occurs sufficiently, make an incision on the gingiva and remove the cover screw using a 1.2 hex driver. Then place the healing abutment. Its diameter and height significantly affect the aesthetics and function of the final prosthesis. If the bone interference occurs due to deeply placed fixture, the healing abutment may not be fully seated. In this case, use the core bone profiler to selectively remove bone. It is designed as its outfit fit to the healing abutment's gingival contour to prevent excessive bone reduction. After removing bone interference with the bone profiler, connect the healing abutment to the fixture. Compared to conventional types, core bone profiler is designed to remove only the bone to fit healing abutment. It can prevent unnecessary bone loss. Healing abutment helps forming a proper emergence profile, which is crucial for the final prosthesis aesthetics and functionality. After the healing abutment period, remove the healing abutment and plant the final abutment and prosthesis. The core implant system offers a wide range of abutment options to accommodate various clinical situations.